Hello, myself Dr. Renuka Tejaswini, working as an assistant professor in Dr. K.V. Subbareddy College of Pharmacy, Kurnool. Artificial intelligence or AI is taking the world by storm, and its impact will be felt in all corners of society, including medicine. Here are 4 ways of AIs. The first way is AI is changing medicine is by assisting with diagnosing and treating the patient's misdiagnosing. A disease happens relatively infrequently, but it can occur due to factors such as physician fatigue, errors in diagnostic modifiers, or limited resources in underprivileged areas. The idea of AI disease diagnosis may sound alarming, right? Should view it was an supportive tool for physicians. For example, the convolutional neural network or CNN is a diagnostic modifier that can analyze thousands of images from public data sets and patient medical records to identify patterns, enabling them to quickly and accurately diagnose diseases. Researchers recently used CNS to diagnose Kawasaki disease or inflammatory disease of blood vessels in children that can prove fatal if left untreated. A diagnostic hurdle with KD is that symptoms are usually vague and can overlap with other childhood illness. To reduce the rate of misdiagnosis, researchers combined images from KD patients, the world building a CNN that can identify its common signs. The CNS produces both sensitive and diagnosing Kawasaki disease, making a diagnosis possibly by a smartphone. Of course, clinically judgment currently remains irreplaceable, and through history, physical examination and relevant labs and imagings, these CNNs can right direction, especially in research restricted locals, which it can be expensive for patients to do more tough preclinically efforts have also demonstrated AI can aid this diagnosis collaterally. Cancer, lung diseases, liver cirrhosis, and many other study board certificates. Pathological diagnosis correlated cancer with 96.9 accuracy, and AI slightly outperformed them, reaching an accurate diseases 98 of the time. However, we shouldn't forget about the limitations of AI in diagnosing disease. Bias and exist in any of the way AI interprets the diagnosis. For example, if a data set is mostly made up of older patients, AI might not be accurately interpret findings for a younger age group. After diagnosis, AI can be aid physicians in treatments, particularly in the era of personalized medicine. Personalized medicine is a form of medicine that uses information about a person's genetics to prevent diagnosis or treat diseases. Right? So one specific example for this rheumatoid arthritis and rheumatic autoimmune disease, where the body attacks itself, especially in joints like the wrists and fingers. Since rheumatoid arthritis is such a complex and chronic disease, there is a variety of medications used to treat patients, and treatment often depends on what each patient's best response to. Researchers and Mayo Clinic can genetically characterize to develop a machine learning algorithm to predict patient response to methotrexate, one of the most important arthritis drugs. Instead of having both doctors and patients wait months to determine the efficacy of a certain drug, these models can direct both doctors and patients towards more effective treatment immediately, saving the patients both time and money. Similarly, researchers at Georgia Institute of Technology and Ovarian Cancer Institute utilized machine learning algorithms to determine treatment effectively with 90% of accuracy for certain chemotherapies. In ovarian cancer patients, utilizing AI to predict a patient response to chemotherapy can save valuable time and spare patients from the effects, emotional burden and cost associated with weeks of treatment, and that they were associated with weeks of treatment that may prove ineffectively beyond diagnosis in predicting the occurrence and progression of chronic diseases like hypertension, diabetes and kidney diseases, which can help patients live longer, healthier lives. Let's take a closer look at diabetes using various machine learning models. Researchers and developing predictive models to estimate a patient's current glucose level based on multiple factors such as their previous glucose levels, body mass index, external stress and even hours of these can help patients anticipate levels are critically high or low, enabling them to better prepare for emergencies. Researchers also used AI to develop models that can predict the livelihood of developing diabetes based on various risk factors. Early diagnosis and treatment of diabetes can prevent complications like diabetic kidney diseases and blindness, which are emotionally distressing and costly for both patients and the healthcare system. In addition to patient care, AI is also further future medical research is conducting, particularly in clinical trials. Clinical study different interventions in patients, usually in the form of new vaccinations or medications, to determine which treatment is more effective in clinical practice. One of the first steps is identifying eligible patients, which is both time and resource consuming, since researchers must design and print brochures and manually screen clinics for LG patients. With access of medical records, AI can quickly identify which patients fit the right criteria to streamline the process. In addition, AI has development of new treatments. The first step in certain clinical research is discovering possible drugs. However, despite extensive lab testing, the discovery process can result in a valuable time and resources. Many drugs that are effectively in a lab fail in human trials. Words Genomics was one of the common companies that discovered a potential drug for a myotropic lateral sclerosis, also known as ALS. By using AI instead of animal or cell testing, instead of cell or animal data, they are used AI to analyze human data points to provide researchers with more accurate representations of effective treatments in humans. This avoids the risk of drug failure, which translate animal studies to human trials. If you are experienced with ChatGPT, you have experienced AI writing capabilities firsthand. While these AI writing tools are far from the can significantly reduce the time needed to prepare and revise manuscripts, ChatGPT has been used in scientific research and has even been credited as a co-author on multiple papers. It's not without its limitation, including the hard to ignore fact that it can reference incorrect data and create fake citations. Other software such as Consequences can be used to guide your initial literature review, provide summaries. Your research questions doesn't expect these tools to take over your academic writing just yet. However, they are brainstorm ideas and collect and synthesize data. We dug into the possibilities and drawbacks of using AI's writing in another video on the future of medical school applications. If you think you can exclusively real ChatGPT for your medical school for residency application, think again. The third way AI is improving medicine is a streamlining administrative task in healthcare. For example, BootMed is a company with a AI service that assists patients with clinical issues like finding physicians on call, scheduling appointments, or answering related questions such as the availability of certain medications on their alternatively allowing AI to take over this task can free administrative staff to focus on other obligations. AI can also simplify medical physicians don't have to take their risk notes or employ medical scribes are opposed to human scribes who are subjected to human error. AI immediately understands medical terminologies. AI technology are pre-authorized insurance and optimized billings for physicians. Since building relevant or accurate consistent documentation, reducing the burdens of these tasks can help prevent physicians burnout, a significant problem that leads to psychological distress for doctors and worse outcomes for patients. Lastly, AI is quickly being integrated into a medical education and all the levels of training. For example, Oscar, an Australian medical education company, allows medical students to practice their own health history taking skills on AI patients. By using tools, students can learn to ask proper questions and consider various diagnoses for any specific presentations. Integrating AI more thoroughly into a formal medical crucial can prepare future physicians for AI's increasing role in healthcare. Some universities like Duke's and Stanford's have introduced courses to help medical students and residents learn to use AI to solve healthcare issues. The Mayo Clinic and Stanford offer courses that teach physicians how AI is currently influencing medicine as well as how they can use it to their advantage in their practice. AI is even influencing the medical school applications processing, which we made a separate video about. The link, the description. AI has huge potentials, resolution, many different facilities, medicine, but with drawbacks or possible bias. We could be introducing AI after all is designed and programmed. Thank you.